Have you ever bent your knee, stood up from a chair, or stepped down from a stair, and felt that pressure, that discomfort, or heard that little crack inside your knee? And right away thought, am I wearing down my cartilage even more? For many people after 50 or 60, this becomes a silent fear. They start avoiding bending the knee, avoiding stairs, moving more stiffly, trying to protect the joint. But here's what almost no one explains to you. Most of the time, it's not the movement that's wearing out your knee, it's the way you're using it. And today, I'm going to show you 3 simple, safe, no-impact exercises that help protect your knee cartilage. And exercise number 1 is the most important of all, because it works on something most people simply never train. And it makes all the difference in how the knee handles load in daily life. So stay with me until the end. Because besides the most important exercise, I'm also going to show you a bonus tip that can really help anyone who wants to take better care of their cartilage and reduce knee overload in everyday life. Before we get to the exercises, let me explain something that can completely change the way you see your knee. A lot of people think the problem is simply cartilage wear and tear, as if it were just age, use, time. And yes, over the years, cartilage can lose some of its ability to absorb impact. That happens because cartilage depends on movement and compression to nourish itself. Unlike other tissues, it doesn't have a direct blood supply. It receives nutrients when you move, when you load and unload weight. And biomechanics studies show that the issue isn't just the load, it's how that load is distributed. When movement is well aligned, the load spreads across the joint. But when there's misalignment or a lack of muscle control, that load starts concentrating in the same spots over and over again. And that's when the knee starts to suffer more. So it's not just natural wear and tear, it's wear and tear linked to movement patterns. And here's the most important part. The right exercise does not wear out cartilage. It improves how the body distributes load. And that's exactly what you're about to start training now. If you want to learn how to protect your knee, move more safely, and keep this from getting worse over time, subscribe to the channel. Because here, I always share simple, safe, straight-to-the-point exercises, especially for people who want to stay active after 50 or 60. Exercise 3. Now, let's start with the first exercise. It's the lightest one. But that's exactly why it matters. Because when your knee is already sensitive, jumping straight into heavier load can make things worse. Here, the goal is to prepare. You can do this exercise lying down. Lie on your back with one leg bent and your foot flat on the floor, and the other leg extended. Now do this. Gently tighten the thigh of the extended leg and lift that leg a few inches off the ground. Hold for a second, then slowly lower it back down with control. The movement is small, and that's important. Because the goal here isn't maximum strength, it's controlled activation of the front thigh muscle. This muscle helps stabilize the knee and reduce stress on the joint. A very common mistake is lifting the leg too high, or doing it too fast. When you lift too high, you tend to compensate, and when you go too fast, you lose control. Here, less is more. If it feels easy, you can hold for 2 to 3 seconds at the top. If your knee is more sensitive, lift less. Do 8 to 12 reps on each side, and notice how the movement already starts to feel more organized. And tell me in the comments, does your knee bother you more when you bend, when going downstairs, or is it that clicking sound that worries you the most? Exercise 2, side kick. Now let's move on to the second exercise, one we use a lot in mat Pilates. This one works on something many people overlook, but that directly affects the knee. Lateral hip control. You can do it lying on your side. The bottom leg stays on the floor, and you can keep it slightly bent to make your lower back more comfortable. Now set your position. Keep your lower back stable, your pelvis stable, no rotating. The top leg stays extended, as if you're trying to reach it away from your body. Here's an important detail. Pull your toes toward your shin and push your heel away. This keeps the leg active and properly aligned. Now start the movement. Bring the leg slightly forward, Then move it back, returning to your body line. Don't exaggerate the range. The focus isn't going far. It's maintaining control. A common mistake is letting the body rotate or losing stability in the lower back and pelvis. If that happens, reduce the movement and regain control. If it feels easy, you can hold for a second at the front and back. If you want to progress, you can add a mini band. Do 8 to 12 reps on each side. And notice how this exercise starts to improve hip stability and how that completely changes the way your knee handles load in everyday life. Exercise 1. Now let's move on to exercise number 1. This is the most important of all, because it works on what truly protects your knee, a strong and well-controlled hip. And we're going to start with the foundation, because the real key here is progression. Lie on your back with your feet flat on the floor and your knees bent. Now, lightly engage your core and lift your hips, forming a straight line from your knees to your torso. Hold for a moment at the top, then slowly lower down with control. That's the basic bridge. The goal here is to activate your glutes and hamstrings, which help take pressure off the knee. Now comes the progression. And this is where the exercise really makes a difference. Once this feels easy and controlled, you can level up, keep one foot on the ground, and extend the other leg. From there, lift your hips while keeping your pelvis stable. Hold, and lower down with control. The most important point here is control. Don't let your hips rotate. Don't let one side drop. If that happens, you're not ready to progress yet. Go back to the version with both feet on the ground. A common mistake is trying to advance too quickly. But here, progress comes from quality, not speed. If it feels easy, you can hold for 2 to 3 seconds at the top. If you want to progress further, increase the time under tension. Do 8 to 12 reps. And when done properly, this exercise can significantly change how your body distributes load, reducing pressure on your knee in daily life. Now, let's turn this into a simple routine. Because what really makes a difference for your knee isn't having one perfect day, it's consistency. You don't need to train for long. 6 to 10 minutes is already enough, as long as you do it with control. In practice, the best time is the one you can stick to. But if you want a simple reference, mornings work really well, because it wakes up your muscles, prepares your knee for the day, and reduces that stiffness you feel in the first few hours. Another option is late afternoon, especially if you notice your knee feels more tired as the day goes on. Now, what you should avoid is doing it carelessly, without attention or in a rush, because here, quality matters more than time. You can structure it like this. Start with the easiest exercise, move into control, and finish with the most functional one. Always go slow. No pain, no forcing. The ideal frequency is 3 to 5 times per week. But if it's something light, well controlled, you can even do it every day, especially when your knee is more sensitive. Now here's something that makes a big difference. Don't wait for your knee to get worse before doing it. Use this as maintenance, as daily care, because when you stay consistent, your body starts to respond better. Movement becomes more stable, your knee feels more reliable, and the overload decreases. Now here's something a lot of people ignore, but that makes a huge difference for the knee: micro breaks. If you spend too much time sitting or standing still, your body starts to switch off. Circulation decreases, muscles relax too much, and joints get stiffer. And when you start moving again, your knee feels it. That's why many people say that when they stand up, it feels stuck, or like their leg takes a while to respond. So here's a simple but very effective adjustment. Every 30 to 45 minutes, take a quick break. It doesn't have to be anything complicated. Stand up, walk a bit, or do some simple movements. You can move your ankle, do a few light knee bends, or even simulate steps in place. Just 30 seconds to 1 minute already helps a lot. And one more important point: if you drive or spend a lot of time sitting in the car, whenever you stop safely, before getting out, do a few movements right there. This helps wake up your leg and prevents that heavy, stiff, or numb feeling when you stand up. It may seem like a small detail, but when you apply this throughout your day, your knee stops staying inactive for so long and remains more active. And that makes a big difference in how it responds to movement. Now let me give you a little bonus that a lot of people tend to overlook when it comes to knee pain, but it can really support joint care. When people think about cartilage, the first thing that usually comes to mind is exercise. And that makes sense, because proper movement is still the most important part. But your joints also depend on your overall body context. That includes sleep, hydration, nutrition, and in some cases, even supplementation. Among the most well-known supplements for joint support, the combination of glucosamine and chondroitin is still one of the most talked about. It doesn't replace strengthening, it won't fix movement patterns, and it's definitely not a miracle solution on its own. But for some people, it can work as an extra layer of support within a more complete plan. When it comes to diet, a great example is salmon, and more broadly, omega-3 rich fish. That's because they can help create a less inflammatory environment in the body, which is especially helpful when the joint is already sensitive. It's not something that will repair cartilage by itself, but it can be a smart addition to a well-balanced routine. So think of it this way. Exercise remains the foundation because it improves strength, control, and load distribution. Nutrition helps your body function better. And supplementation, when properly guided, can be a useful add-on in certain cases. When you bring all these pieces together, your approach to knee care becomes much more complete. Now, an important warning. If you notice your pain is increasing, if there's swelling, instability, or no improvement over time, the best thing to do is seek evaluation from a doctor or physical therapist. Every knee has its own story, and individualized guidance makes a big difference. And if you feel like you need something more structured, with a ready-to-follow progression to strengthen your knee and improve control safely, I've left the knee program in the first pinned comment. Now tell me something. How old are you? And do you already do any exercises for your knee? Drop it in the comments. That already helps me better understand your case. And if this video helped you, make sure to subscribe to the channel. It really helps me keep bringing you straight-to-the-point content, with safe and practical exercises for anyone who wants to move better after 50-60. And in the next video, I'll show you a very common mistake that increases pressure on your knee without you even realizing it. See you in the next one.